So one of the most common questions or requests that I have from patients coming in is, I want a breast lift, but I don't want breast implants. Okay, so the question is, how do you define a perky breast? So we have a classification that refers to breast ptosis, and ptosis is Ptosis. Now what that means is we relate to where the nipple is in relation to the breast crease or the underwire. So let's all agree that this is about the ideal shape of a breast. Grade 1 ptosis is where the nipple falls at or maybe slightly below the crease right here. Grade 2 is where it falls from about 1 to 3 centimeters below. And grade 3 is where it falls to the bottom of the breast or below 3 centimeters below the crease. Now there is a condition called pseudo ptosis, and as you know, pseudo means false, where the breast just loses volume, most commonly after nursing or after weight gain or weight loss, and has this bottomed out appearance right here where the gland drops below the fold. So that's called pseudo ptosis. So it's too complicated to talk about all the different methods of breast lifting, but essentially the important part of a breast lift is getting the nipple into the proper position, which is about at or an inch above the level of the fold. So regardless of that, when somebody comes in and they have a breast, let's say a grade 3 ptosis that looks like that, and that's where the crease is, the ultimate goal is to get the nipple up to about this level. Now, in the early phases of most breast lifts, you may have a breast that actually looks like this. And typically, with a scar, you might have a scar that goes down here. This is going to be excessively full. What inevitably happens over time is that this will stretch out. And so what will happen is, over time, this breast will eventually look, even though the nipple's at the same level, will look like that. So you can see with this breast, even though this breast has been lifted, it is not necessarily perky or full. So there have been a couple different methods that have been proposed to maintain the fullness, such as the laser bra or various meshes. They generally don't last. The most reliable way of achieving upper pole fullness is predominantly with an implant, or secondarily to achieve some fullness with breast fat transfer. Okay. So again, just drawing that out, if we're starting out with the breast that looks kind of like this, and we do a lift alone, you're going to have a look that looks kind of like that. Long term, and meaning over about 6 to 9 months, this breast is going to look like this. By putting in an implant into that area, namely right around in here, you will then achieve an implant sitting here, and that breast will essentially look like that and give you the upper pole fullness. Okay. Now that's if we perform it staged. Of course, if we were to perform this at the same time, this will be exaggerated, meaning that this breast with an implant in the very early phases may look something like this, where it's very firm here and you've got the implant sitting here. And again, over a 6 to 9 month period right here, that breast will end up looking more like that as this tissue right here stretches out and becomes rounder, and the implant will drop, commonly known as the drop and fluff. Now, a lot of you may ask, what happens if I don't want an implant? Well, number one is you won't achieve the fullness, but if you don't want an implant and you want to compromise, you can use some fat transfer. Now, in that situation, let's go back to this. While you start off with the breast that may look like that, if we add fat initially, you will achieve a little bit more fullness up there than you would, let's say, without fat. So this would be fat. Now, over time, what will happen is this will continue to stretch out. And whereas a breast without fat may look like this, a little scooped out, a breast with fat is going to tend to have a more straighter profile. So that would be the advantage of using fat without an implant. The only way to get marked upper fullness is either going to be with the bra or with the implant.